My superpower today, I would say, is being a connector. And so often when I'm talking to so many people, usually say, "Oh, Brian's network. Oh, Brian's a big networker, this and that." And I always tell them I'm not really a networking person because words matter. And usually with networking, it's I'm trying to build something with somebody to get ahead or to get some new skill set. I look at myself as connector. In many ways, I just love people in general, and I think everybody has their own superpower, and I just love to hear people's how what their superpower is and their story. Because throughout my life, when you talk to people, everyone just assumes everyone has a straight line, and they woke up one day and like, I'm gonna be a doctor, or I'm gonna be the CEO of a bank, or something like that. But then you start learning they had a lot of interesting experiences. Where I remember one leader I was talking to, he was like, "Oh, actually, I wanted to be a carpenter." And he's like a major CEO of a big, like, regional bank, and I was like, "That is so different." But he's these are the things I learned from doing carpentry that I've applied today. So I think my superpower is connecting people, and I think when I'm
Mhm.
most happy is when I can connect 2 amazingly dope people together that I heard their story and what they're trying to accomplish and the problem they're trying to solve, and I know this other person's trying to do that, and then connecting them and then just watching the beauty of that relationship happen. I would say definitely a connector for ideas. And I lean a lot into this idea of how do we build community intelligence? Because we all, especially when we talk about health equity, can't be done in isolation. It's not like I'm going to solve anything, but it's us as a collective that have to do that. And so, how do you create bigger value with it, making people have those connections and finding each other? My grandmother was really big about community intelligence. And so that's where I think that superpower was starting to get cultivated. Kindness was a really big thing for her. I think when we talk about kindness versus being nice, some people are like, oh, don't be a pushover. I can tell you the truth in a kind way. And she really was big
Mm.
about, she was very much an activist herself in her own. She was very deeply, both my grandparents were very deeply involved in politics. And really, hey, our communities are not doing well. Are the roads messed up? Mr. Smith has been complaining about his back for the past 2 weeks, and I haven't seen the nurse go out to him. And she was really big about how she could do her own Gemba walks within the community, get to learn where people are at, what's being impacted. And she would translate a lot of those things to the local nursing station, which would then deploy what services need to be out there. And so I learned a lot of things around kindness from her, around you have to go to the community where people are at. You can't just be in your kind of big tower office and think, oh, I'm going to be doing things around social drivers of health here. I'm going to do equity work here. Unless you're in relationship with people closest to the problem, because often they have the
Mm.
actual knowledge of how to fix the problem. And I just look at myself as like the translator to translating it to the people that need to hear that message and being the voice when they don't have a voice at that table. And so my grandmother was very big about that, and she is very big about constantly making sure that we are educating ourselves. She would often say, "The passport through life is through education." And she's like, "It's not just about the formal education of your degrees and your pedigree." She never had any of those fancy degrees, but what she was good at was educating herself on the community, educating herself with the people that matter to her. And so that I would say is from the lessons that I learned around just idea of community and then community engagement. And I always like to remind everyone that's listening, you are part of public health. You just may not know it yet. You don't have to have an MPH. You don't have to have a DRPH. You don't have to have a PhD. We all have a social responsibility to make the world a better place with whatever skill sets, whatever industry that we're in. And that's how I always say we have to build the tent of public health and making everyone realize that they're part of that journey.
This is Social Justice Origin Stories. I'm your host, Rolando Tompkins Jones. Social Justice Origin Stories is a storytelling project that highlights personal stories and defining moments that have inspired individuals and organizations to labor for equity and social justice. Through truth telling, the honest sharing of their experiences, storytellers teach us about themselves, enabling us to learn about ourselves and our world through their stories. By reconnecting with pivotal moments of activation in their lives, they invite us to do the same. At Social Justice Origin Stories, we believe that there's power in storytelling and lived experience is experience. There's room enough for all of us to do this work. There are many ways to contribute, and our contributions don't need to be the same. We can enter and remain engaged in the work using the gifts that are special to us while supporting others and using theirs. We have the capacity to grow and change for the better when exposed to new information and experiences. We believe in our inherent worth and capabilities, and we possess the power to inspire and create change within ourselves and others. We can transcend the confines of the status quo to imagine and design more equitable and humanizing systems. Today, we're joined by Dr. Bryan Buckley. I remember you from my days of coordinating the Future Public Health Leaders Program at the University of Michigan School of Public Health. And when I talk about making our experiences accessible to others and the importance of doing that, Dr. Buckley, you came in, and this is prior, to Dr. Buckley, but you came in, you just being you and giving and sharing of your story to the students. And and we talked about that in terms of you just by being yourself. There's something really transformative about giving of your time and sharing with the students and making your experiences accessible. So I appreciated you doing that then. And many of those students they're doctors and dentists and they're social work. They're doing many different things now, and appreciated you being a part of their journey in that way. And then I appreciate you coming back today to share your social justice origin stories with our listeners.
First, thank you, Rolando, for the invitation. And you inspired me a little bit because half the time when you do these talks, you never really know if you really make an impact. And so thank you for one, just acknowledging that. And I always love to try to be myself as much as I can. But for the audience listening, Bryan Buckley, he, him pronouns. So I have a lot of different hats I wear, but right now the people that pay me I'm the head of public health for Care First Blue Cross Blue Shield. For those listening, you're like, what is that? It's one of the largest health plans within the Mid-Atlantic area where we serve 3.5 million members. And I get to oversee their enterprise work around health equity and our partnerships with local and state health departments. But then the other hat that I wear, I like to think of myself as a pracademic, but I also am an assistant professor at Georgetown University where I work on change management and community-based partnerships. So both working at the School of Health and also the School of Medicine. And then overall, just a public health guy through and through on trying to make change happen in our communities.
So one of the questions I've been asking, I've been using this quote from Corey Bush, which says, many of us do not choose to become activists. Instead, we are activated. And so what are some of the things that activated you in your journey?
Ooh, that's a good question. Activated me. I've had so many. It's funny. I was talking to my wife the other day about this. Like when I talk about these different parts within my life and journey that were like pivotal moments on how I came to be. As you can see, Bryan Buckley, I'm obsessed with the letter B. And I say that because I think there's this idea of how do we really be into our own story? How do we look at our origin stories? How do you think of ourselves as heroes in this regard? And so I say one of the first pivotal things that has helped activate me has really been my Caribbean background. So I'm a first generation Caribbean American. My mom is from Antigua. My dad is from St. Kitts Nevis, but his parents are from Antigua. So usually Antigua becomes the center of space. And I did a piece a while back ago around how I learned everything about health equity, my Caribbean upbringing. And so like for many people, you're hearing, oh, Caribbean, that's cool. And I would say often to people, I went to Antigua every year from till I was like 18 for the summer. So like you might get sent to summer camp, I got sent to the Caribbean. And the first thought you're thinking, because I know it's the thought everyone else was thinking is like, man, Bryan was on the beach, sipping pina coladas, just relaxing. No, that was not my experience.
No.
We were in like rural Antigua where the mosquitoes were biting us up. No AC at the time. And you just had to, and there was nothing to entertain you. There's not like the same technologies that we have here, but it taught me a lot. I had to learn how to just be with myself and be around community. And my grandmother, she was the principal, and she'd have all of her grandchildren come to the house every time my sister and I would come. And we would walk the community, and she would introduce us to everyone in the community. And she would have us go out and say, to have us introduce ourselves and understand where people's walks of life were. And that was such a pivotal moment. And when I reflect back, I learned a lot of the things around how do you think about community? How do you think about partnership? How do you think about just meeting people where they're at? So I'd say that was a key pivotal moment from like just the foundation of who I am. And I think as time went on, aspects of college helped shape me a lot, because one of those things that for so many people that are listening, some people stay local and some people go out. So I was born and raised in Maryland. And so I went to Michigan State, So completely separate from my community. And I knew no one at Michigan State. So it really made me start to reflect on what did I know? How did I present myself? Who do I want to be in this new group of people? And so Michigan State has a very special place in my heart. And one, both activating me and finding my passion for public health and health in general. But I always tell people I was born in Maryland, but I truly became a man in Michigan. And it helped me really shape and build connections. The Michigan culture is so different from the hustle and bustle of the East Coast. And it made me just be in the moment. I learned to enjoy things like camping, going to a brewery, and just having conversations with random people. And so I'd say that'd be the second piece of activation. And then the third, I would say when I went to Massachusetts to go work on my doctorate at Harvard. So I did my doctorate in public health at the Harvard T.H. Chan School of Public Health. And that was a monumental moment because it's like all the things around my Caribbean heritage, learning all the things I learned in Michigan, now coming to this institution where there was a lot of imposter syndrome for myself, being a Black man with meeting people that were going to be senators and House representatives in the future, have been like leading not-for-profits across the globe. I remember that moment really helped me lean into who I was and what my superpower was. And it helped really train me to think, okay, I don't need to be like everybody else. I don't need to look at all my mentors and be like, I need to be like you. I need to do what you're doing. But help me lean back, step back and say, hey, Bryan, what's your superpower? And how do you be amazingly good at that superpower and your own unique style of leadership? And I said, I think that's really where it made me who I am to Dr. Buckley today throughout all those pivotal moments within my life.
Now, a couple of things. I felt like you mentioned some of those earlier experiences where you learned about the importance of community and how to build community. So, how would you describe what your superpower is, and then how that superpower informs your style of leadership and the ways that you connect with folks? And then, if you could go back into when you talked about how that earlier experience helped you learn the importance of community, say a little bit more about some of those learnings and the significance of building community.
Yeah, for sure. My superpower today, I would say, is being a connector. And so often when I'm talking to so many people, usually say, oh, Brian's network, oh, Brian's a big networker, this and that. And I always tell them I'm not really a networking person because words matter. And usually with networking, it's I'm trying to build something with somebody to get ahead or to get some new skill set. I look at myself as connector. In many ways, I just love people in general, and I think everybody has their own superpower, and I just love to hear people's what their superpower is and their story. Because throughout my life, when you talk to people, everyone just assumes everyone has a straight line, and they woke up one day and like, I'm gonna be a doctor, or I'm gonna be the CEO of a bank or something like that. But then you start learning they had a lot of interesting experiences. Where I remember one leader I was talking to, he was like, "Oh, actually, I wanted to be a carpenter." And he's like a major CEO of a big like regional bank. And I was like, that is so different. But these are the things I learned from doing carpentry that I've applied today. So I think my superpower is connecting people. And I think when I'm
Mhm.
most happy is when I can connect two amazingly dope people together that I heard their story and what they're trying to accomplish and the problem they're trying to solve. And I know this other person's trying to do that. And then connecting them and then just watching the beauty of that relationship happen. I would say definitely a connector for ideas. And I lean a lot into this idea of how do we build community intelligence? Because we all, especially when we talk about health equity, can't be done in isolation. It's not like I'm going to solve anything, but it's us as a collective that have to do that. And so, how do you create bigger value with it, making people have those connections and finding each other? To your second question around some of the lessons learned around community, one, I highlighted it with my kind of connector side of the house. Caribbean people by nature are just very connected people, very pro-social, very community focused. And so my grandmother was really big about community intelligence. And so that's where I think that superpower was starting to get cultivated. Kindness was a really big thing for her. I think when we talk about kindness versus being nice, some people are like, oh, don't be a pushover. I can tell you the truth in a kind way. And she really was big
Mm.
about, she was very much an activist herself in her own. She was very deeply, both my grandparents were very deeply involved in politics. And really, hey, our communities are not doing well. Are the roads messed up? Mr. Smith has been complaining about his back for the past 2 weeks, and I haven't seen the nurse go out to him. And she was really big about how she could do her own Gemba walks within the community, get to learn where people are at, what's being impacted, And she would translate a lot of those things to the local nursing station, which would then deploy what services need to be out there. And so I learned a lot of things around kindness from her, around you have to go to the community where people are at. You can't just be in your kind of big tower office and think, oh, I'm going to be doing things around social drivers of health here. I'm going to do equity work here. Unless you're in relationship with people closest to the problem, because often they have the
Mm.
actual knowledge of how to fix the problem. And I just look at myself as like the translator to translating it to the people that need to hear that message and being the voice when they don't have a voice at that table. And so my grandmother was very big about that. And she is very big about constantly making sure that we are educating ourselves. She would often say, the passport through life is through education. And she's like, it's not just about the formal education of your degrees and your pedigree. She never had any of those fancy degrees. But what she was good at was educating herself on the community, educating herself with the people that matter to her. And so that I would say is some of the lessons that I learned around just idea of community and in community engagement.
What's your journey to public health look like? How did you arrive at, hey, this is an area for me. This is something that I want to explore. And I think I can do some good work in this area. How did you get there?
It's funny, this question comes up so many times. I fumbled into public health by accident. I wanted to be a doctor when I went to school, and nothing against doctors or doing medicine. But I think one thing I discovered, and I alluded to, Michigan helped me grow a lot. I realized I was asking myself, like, why do I want to be a doctor? And I realized I wasn't really living my story. I was living my parents' story. When you come from a Caribbean family, you either have to be a doctor, a lawyer, or some type of businessman. And I realized I didn't really have a passion for being in medicine at all. I was more so trying to make my
Mhm.
parents proud. And I think so many kids come to that conclusion where when I'm talking with them, they're like, oh, I don't really care for this. But I feel like if I don't get this, they won't feel proud of me. And I had to have that moment where I was like, I had to unlearn that and say, okay, Bryan, what do you enjoy doing? And it required a lot of failure and discovery and trying out a couple of things. I had landed at the time in microbiology, and I was like, "Oh, I'll be like a lab tech." I had a cool internship, and I was like wanting to do that. And um, I was in one of my microbiology labs, and I've always been a social butterfly in many ways. I said I'm the connector, right? And I
Yeah.
remember my professor, Dr. Porna, she just started teaching that lab class, and she like noticed me talking to everyone in the lab, and she's like, "Oh yeah, Bryan, what are you trying to do next?" And I was like, "I think I want to be like a lab tech or something like that, and maybe I'll do a PhD in microbiology. I don't know." And then she literally pulled me aside. She's, "Do not take this the wrong way, but I feel like you have a superpower that could transcend so many other things. Have you ever considered public
Mm.
health?" And I was like, "What's public health?" I remember asking that question in my junior year, "What is public health?" And she was like, "Well, as a microbiology, you could take an epidemiology class, which is in line with the public health thought process. It's part of your curriculum, so it won't take you too far out of the scope. And she take the class and let me know what you think." I took that class. Dr. Michael Rick was teaching it, and I ended up falling in love with public health. I was like, "Oh my goodness, I didn't even know this field existed." And I just kept on going and took that to doing my MPH at Michigan State, and then just got really involved with public health during the time of when I was like, before I started my doctorate, got to work in the Michigan Public Health Association where I learned more about APHA. And even to this day, I'm on the board of APHA. That one story, and Dr. Rennell Brew, I remember when she came to our class and was like, hey, this is what APHA is, and this is how you can get involved. And how that one conversation took me all the way to being on the board of the American Public Health Association. I got to work on the Flint water crisis. I got to work on aspects of gun violence, both in Detroit and Flint. I got to work in so many pieces, and I just got excited about it and just kept on going further, which took me to my doctorate in public health, getting a terminal degree. And I got a DRPH intentionally because I didn't want to just focus on researching a problem and trying to discover new knowledge. I think we have a lot of knowledge out there. What we don't have is the courage to actually change the systems to making life better for people where they live, work, and play. And so I got that DRPH to be more practice oriented, taking all that research and really translating, thinking about negotiation, thinking about how we frame, thinking about persuasion and econometrics, thinking outside the box on a lot of things. And so that's how I got into public health, still doing it now, the head of public health for a large health plan. And the public health movement has changed so much. And I always like to remind everyone that's listening, you are part of public health. You just may not know it yet. You don't have to have an MPH. You don't have to have a DRPH. You don't have to have a PhD. We all have a social responsibility to make the world a better place with whatever skill sets, whatever industry that we're in. And that's how I always say we have to build the tent of public health and making everyone realize that they're part of that journey.
I love that. I love that you are a part of public health. You just didn't know it yet. And that's one of the things I really saw, just the transformative powers of, again, storytelling, but then also a lot of what you were saying, particularly just thinking back in the days of working with the Future Public Health Leaders Program, is you are a part of public health. You just don't know it yet. And then as the students were exposed to leaders like yourself and others who are working in the field, it's, oh, yes, all of these things that are all around us that impact our daily lives. This is public health, and just how that connected so many dots and like it was a light bulb for so many students. It was so important. Thank you for sharing your story. Also, I appreciated you just naming and realizing, oh, there was a point in time where I realized I wasn't really living my dream. I was living somebody else's. One, I really appreciate you sharing it because I think it's important because there might be some other folks who are listening to this now who may be in that, maybe trying to figure that out of, am I going down a path that I would really choose for myself, or am I going down a path that others have chosen for me, for a variety of different good intentions, even in some ways, but still for a variety of different reasons, others may have chosen for me, or am I going down a path that is actually resonating with how I feel like I can bring my gifts to the world? And so I appreciate you naming that as well. For the folks who are listening, I hope you caught that. I want to hear about the work that you're doing now in your role. But then I also, and perhaps this question may respond to that. I want to hear, are there memories, a certain time period of when you were engaging in your work across the years of your experience where you just felt really engaged with the work and where you felt like, this is why I do this work. This is public health. I'm so happy to be a part of this. This is why I do this.
Yeah. So for the first part, to say what I do today. So as I mentioned before, head of public health for Care First. I'm a Blue Cross Blue Shield company that services both the Maryland, DC, and Northern Virginia area. So I oversee our health equity enterprise strategy. You might be like, what does that mean? And why does a health plan have a public health function to some degree? And so a lot of this was birthed out of the movement that's been going on in healthcare where health plans, hospitals all of a sudden discovered social drivers of health, where you live, work, and play impact your health. It's marvelous on how they just discovered this a couple of years ago. But if you're a true public health person, you had known that this has been research that we have known since way, way back. And really, this idea that ever since George Floyd's murder, we actually haven't gotten that far with actually making systems equitable. And the way I like to look at my job in many ways is I believe that and I'm going to use a DC analogy here. There are a lot of superheroes across Care First through our marketing side, through our investment strategy, external relations, public policy, so forth. They are doing amazing jobs. My job in many ways is to be the watchtower to help coordinate the work, the watchtower to help making sure that we are celebrating those small wins and really a place where people can get advice and guidance and being coached to how they can cultivate their own unique lens of a situation and then make it better for the members that we serve, which is about 3.5 million members within the region across all lines of business. And so my day to day is really helping to be that connective tissue across the organization, leaning into my own superpower that I mentioned earlier as the connector, coaching people on how to think about things, asking those thought provoking questions. Because when we talk about health equity, it requires us also unlearning a lot of the things that have benefited a lot of people throughout society. Um, Often people used to say this whole idea that we need to bake equity into the work that we do. And I was like, anyone that has done baking, you have to remember that if you put salt instead of sugar, there are inequities baked into the system as well. And so if we're going to do that,
Yeah.
we just have to throw out the whole entire system and start from scratch and asking ourselves, why are we doing it this way? I'm a big Deming fan, and his quote would always be, every system is perfectly designed to get the results it gets. And so how do we start thinking about that and thinking about why do I do this? Even just a random side story, talking with my cousin, and Antigua is very conservative on like when we talk about religion. I did a talk and I say I'm Brian Buckley, he, him pronouns. And he was like, oh, like, why are you using pronouns? And I asked them a question because often people just think it's about the LGBTQ plus community. But I was like, no, not everyone has the privilege that may look like me, that it might be more obvious. Not everyone feels comfortably and psychologically
Mm-hmm.
safe. I met Rodney Smith. In your mind, you might think, oh, that's a man. No, it wasn't. And how pronouns also help us just identify who it is. He's like, why do we have to use that? I was like, why do people call me Dr. Buckley? We've already accepted certain things already as this is just the way we do things. I was like, I just went to school longer than most people, but that doesn't mean I have all the knowledge in the world. Half of the time is me
Mm-hmm.
being to knowing who the people that have that knowledge and using that privilege in a way that allows their voice to be elevated. So I think those are the things that, are really important in how I'm trying to push the organization to think differently, to care and think about that strategy. To the second question that you had about like a story about just when I woke up and be like, yo, I love what I do. I'll use two.
Mm-hmm.
Say when I was at the Michigan Health and Hospital Association, it was one of the first jobs that I just truly enjoyed. That I found I just this is why I was built. One, I had an amazing supervisor. Shout out to Steve Levy out here, which was he pushed me to be better. I used to have a humongous stage fright. Like when it came to public speaking, I most people. Actually, I think the research has shown that people are more afraid sometimes of public speaking. It's like the second following death. And
Mm-hmm.
so some
It's up
people
there.
don't. And I remember I asked him, I was like, I have issues with public speaking. And he's like, I'm gonna do, I'm gonna have you present to our board and ask for $500,000. I was like, wait, what? He was the only way we can do this is exposure therapy. So I had a really great boss that cultivated my talents. And I had an amazing CEO, shout out to Bryan Peters, which was the first time I heard around sponsorship. We talk about I remember Bryan Peters called me up one time and was like, hey, I want you to go talk to this guy. And I was like, okay, cool. I'm talking to it's an older black gentleman. He's really known in the world in Michigan, very influential dude. And I was like, hey, I was told to talk to you, but I have no idea what we're supposed to be talking about. I didn't get the instructions here. He's like, oh, Bryan didn't tell you? I was like, no. Bryan and I were meeting up, and Bryan told me, I have this really, really great guy at my company, and I see him being something someday. Would you mind mentoring him? And I was the first time I had
Mm.
even heard about sponsorship and this idea of when I'm not even in the room, someone's talking and trying to uplift me. And so I think that whole entire how they were trying to incorporate health into it. Didn't really think about social drivers, didn't think about health. I was so happy there because I had a team, a leadership, and they allowed us to go beyond and think outside the box and question the box. And I got to lead a lot of their initial health equity strategy there and still have really good relationships there with Sam Watson and others that are still there. And so that was definitely a time that I was like, yo, I really love doing what I do. And I would say the second one is probably in my last job, NCQA, National Committee for Quality Assurance. I was the health equity lead and oversaw the enterprise-wide strategy around health equity. And they essentially accredit health plans. I enjoyed that job too. I've enjoyed most of my jobs because I get to be in a space where I get to challenge the status quo a little bit and having courageous moments. It's like the whole idea of killing them with kindness and be like, hey, I hear you're against in that role. It was very external. So it's like I would talk to people that are like, this whole DEI thing or this whole thing, blah, 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 is how do we reframe those stories? Like, you're saying this, but what I'm seeing on the ground is people are dying. Those are brothers,
Mhm.
sisters, your neighbors. And we need to come with
Yeah.
that realization that I don't care what it's named. What are you doing to think about economic inclusion and making sure that people are not dying every day? You're getting caught up in the title of what it is. What are
Mhm.
you doing? Your solution. And I think when you challenge that and you ask, what are you trying to do to contribute to a better society? If you don't have an answer, then I'm not really in the business of trying to talk to you. And so I think those are cause used to get really excited about that. And I guess I still technically get to do it a little bit today. So I say those two stories are just moments where I wake up and I'm just like, ooh, I'm excited today.
Systems produce what they're designed to produce. I really appreciate you naming that. Yeah, systems produce what they're designed to produce, but we're all designers though. So to put it back out to the people to say none of what exists here is by accident. Systems produce what they're designed to produce, but then also, hey, we can design other ways of doing things. There are other ways that are possible. And so I appreciate you naming that as well. You talked about the difference between mentoring and sponsorship. So bringing up the significance of that, mentioning you had stage fright. And then also a few things I'm trying to explore with this project is our relationship with resisting internalized oppression, resisting the negative messages we get about our identities and where we experience some marginalization. And then also from our places of privilege, those identities that we hold that have some privilege, what's our relationship to then understanding the world is made for us in different ways that it's not made for other people? And how are we then going about trying to rectify that? I would say, what's your, and you mentioned imposter syndrome a little bit when you were with the PhD. What's helping you in resisting internalizing those negative messages, the anti-Blackness, the other things that may be present? And then also, when you think about the privileges that you have, what's your relationship to trying to move in different ways that open up access? I appreciated your example with the importance of sharing our pronouns, because again, you talked about baking, and if you bake, there's inequity baked into the process. And that, even as an example, is one way. Here is something that we can do to design our environments in different ways that are acknowledging there's a variety of different people in the space. So it's not just cisgender people in the space. And in your examples of that, maybe it brought me to that question of what's our relationship with both resisting internalized oppression and leading for equity from that space, but then also resisting those notions of internalized superiority as well.
Yeah, so I guess the way I would answer, which was touch on both questions, is my community. I'm a big
Mm,
fan of the importance of social capital, and social capital can, just to define it, is social capital can lead to political capital, financial, and intellectual capital. And I have created my community in a way where I don't just find people that think like I do. I love to have people that I can debate with. I have people on my speed dial that we get into debates, like really deep debates, but we sharpen each other and it makes me see things that
mm,
I don't see. I also have my cheerleaders remind me, hey, Brian, you've actually accomplished a lot. Because believe it or not, sometimes my wife, she hates when I say this. Sometimes, like, I think to myself, have I actually done anything? Even though, like, my
that's
wife will
real.
look and be like, have you looked at your CV or your resume? There's moments where I'm like, have I really given it my all to this? And one of my vision statements for myself is to exhaust my talents as a nexus for change be my blessings, failures, and community. And so that vision keeps me grounded. There's still a lot of work to be done, but it's okay to give yourself a little grace. You don't have to do it all by yourself. So that helps me think about those negative messages when I start to hear them, and even negative messages of when I was a kid. I remember often, like, for example, one salient one, since we're being very vulnerable on here. I remember when I was a kid, I was very much one of those kids that was teased, man, why do you talk so proper? Oh, you talking white or this, or
Mm,
you're an Oreo. These messages, that childhood trauma, it can make me
mhm.
very insecure about speaking out loud when it came to stage fright because I didn't like my voice based off of what I heard from as a kid. But then it's like reminding myself, like, those, they didn't know any better. And just because someone gave you that feedback, you don't have to buy it wholesale. That was their moment of how they thought about it. That doesn't define who you are today. And so the second
Mhm.
thing around aspects of my own privilege, I think it's being very acutely aware that I do have a lot of privileges. And I would say the person that has helped keep me very humble with that is my wife. She's like my awesome half that keeps me grounded a lot. Because I grew up in a middle class family. My parents, although Caribbean, you have to think about people that are able to immigrate from the Caribbean to the US had a sense of privilege where they were. And I grew up with privilege. I got educated, went to private school. I have a doctorate from Harvard. I know and very acutely aware that, hey, there are these privileges that I have. But I think what has kept me grounded, my wife, she grew up in Flint, Michigan, divorced parents. She's kept me really humble to remember. Sometimes she'll do like, hey, Brian, your privilege is showing. Because you need people in your life to keep
Mm,
you accountable. Hey, you said that, Brian. I know you had good intentions, but the impact it had on X by XYZ wasn't where I think you were trying to land. And so just having people around you to give you that feedback. And I think often people don't want to hear feedback. They like to think of themselves as like the superior person. I welcome it.
Yeah.
And I usually like to hear people tell me, like, where did I miss the mark? And instead of even asking the question, did I do okay? Because everyone says, oh, yeah, you did great. I usually always ask, what's one thing I could have done better to get this point across? So getting people to be hyper focused on the one thing, because I don't want to just be mediocre. I don't want people to just leave thinking, oh, he's a Dr. Buckley, so of course he's going to do amazing. But I want feedback and I'm hungry for that. So I would say that community approach has definitely helped me stay centered. Might annoy my friends a lot because they'll get like random texts. Like, what do you think about me? If you had to describe me in one word, where do I need to work on? What's one thing I could work on? And they're like, oh God, Brian's doing his little reflective practice 360 again. And so I think those are the things
Yeah.
that help keep me humble and reminding myself of the privilege and being grateful on the very privileged life I've had, but know that it comes with a charge to make sure that I use that privilege to make the world a better place. I'll close with this
Mhm.
part. My grandfather would say we have two reasons to be in this world. One, to make the world a better place with whatever privileges and gifts that we've been given. And two, to mentor and coach the next generation to build on that. And so I think that's my mantra through life on how I think about that privilege that I've been blessed with. But then the responsibility I have to make sure I don't just let it stay with me, but I'm giving it back to the world.
Mhm. Mhm. Now, you've named a few people so far. Who or what would you name that has supported you in terms of shaping how you show up and how you lead and examine problems? What informs your approach to equity? It could be mentors, it could be books, movements, things that have been significant to you on your journey.
Yeah, that's a good question. So there's so many, but to keep it short, one, I would say my grandparents were very big influential figures in my life. They taught me so much, both on my maternal and paternal side. My maternal side was the story I talked about going to my grandmother's house, my grandparents' house, and really walking the community. That has shaped. But then my grandfather and grandmother here, my dad's parents, just hearing his story. So my grandfather, he also is Dr. Buckley as well. But the thing you may not know about him, and this is why there's the public message and then the private message. When he immigrated to
Mhm.
the US, they didn't accept his schooling that he did in Antigua, so he had to start high school all over again at the age of 33. And he went from high school all the way up to getting his bachelor's, his master's, and his doctorate. And when I
Mhm.
graduated from Harvard, I graduated at Harvard at 33. And just to see the difference in 2 generations, from an immigrant man that came here that had to start from scratch to what his grandson was able to accomplish. And so he's always been a big pusher to just push hard. And then his wife, she taught me all I think I need to know about kindness. She is one of the kindest people I know. Both my grandparents there are still living. And she just exuded how to be a good person, but also speak truth to power in a kind way. And so I would say family is very centered for me and encouraging me. People that I guess from a health equity perspective that have helped me along the journey, I'll do a quick round robin of shout outs. Shout out to Dr. Renee Kennedy, which taught me everything I need to know about health equity, CEO of the MPHI. Shout out to Steve Levy, Sam Watson, Bryan Peters at the Hospital Association, which really helped invest in me. But even shout out to Dr. Brian Castrucci. He is like a firehouse. He runs the De Beaumont Foundation and has just taught me how to be wickedly smart around how do you show data, show narrative, but then challenge the status quo. But then many of the supervisors I've had across the continuum between Anna Goslin when I was at Blue Cross Blue Shield, Dr. Kimberly Leary, which is my advisor for my doctorate, to even Dr. Chris Goschel when I came to MedStar and came back to Maryland, to Sarah She, NCQA, even to my boss now, Lester Davis. I've had really good mentors and colleagues along the way. And actually, one shout out, Dr. Jerry Caldwell, because I was just in Michigan the other day for his retirement, but ran the Charles G. Scholars Program
Mhm.
at Michigan State, where my wife and I met. Him and his wife married us. And so I've
Wow,
been
that's
very
full
blessed,
circle.
full circle, man. So I've been blessed with, and the list could go on. We'd be on this podcast for 5 hours. I've had so many cool people in my life, both family, friends, mentors, sponsors, that really poured into me. And they didn't just pour into me saying, hey, these are all the things I hope for you. but they poured into me the lessons learned in life, their failures. And they sat with it like, hey, I didn't do this very well. Maybe you can take the baton and take it further. And so I was just really a shout out to all the people that have been in my life that have contributed to me and really helped mold me.
In thinking about the collective of all the folks that you just named, what would you say to them or about them in terms of just gratitude for their investment of time and support and sponsorship and mentoring, all those things? What would you say to them or about them?
Hey, thank you. Thank you for taking a bet on me. Thank you for the folks that have passed. Thank you for your stories, your challenges, challenging me. I think I literally stand on their shoulders in many ways. And some of them might think, oh man, I didn't really have an impact on Bryan, but you did. You know me and I've talked to you. You had an impact because you shared your story. And so I just would just tell them thank you and just a deep gratitude and know that I am taking their stories and trying to make impact. And they are part of that origin story of Bryan Buckley.
What do you hope listeners would take away from your story? And then what actions would you encourage them to take?
So I'll answer both questions in one, which is my mantra. As I said, I'm obsessed with B, right? So one of the mantras that keeps me going is this idea of be hungry, be curious, and be humble. Be hungry to figure out what's the problem that you're trying to solve in society. Don't get into the whole what do you want to do? What problem do you want to solve? Because it allows you to bring your full self to trying to address that problem and seeing where you need to create partnerships, where you need to make things happen. Second is being curious. I think there's many different ways to accomplish in solving a problem. Some of it's through formal education, sometimes it's through partnerships, sometimes it's going and starting a company. There's many different ways to do that, but then also remembering that you have to think outside the box, but you also have to question why the box even existed to begin with. And we will never truly get to a just society if we always don't question the box that we're actually operating from. And the third I would say is be humble. You can't do this work alone or in isolation. For us to get to a truly just society, it requires building community. And so don't do it alone. Find the people that challenge you, find the people that encourage you, find the people that give you new ideas that inspire you. This work is coalition work. And so I just really reiterate to people, it keeps me going, but I hope it keeps other people going and just remembering to be hungry, be curious, and be humble.
Okay. Okay. So now we're at the 3 prompt place that I told you about.
Okay, I'm nervous
So
about this.
I have 3 prompts. I have 3 prompts and I just say finish the statement. And it's a snapshot of where you are in time. Like
Eh,
Bryan, I can ask you the same question 6 months from now. You might say something different, but it's just where you are right now.
eh.
The first one, here it comes. Here it comes. First one. Finish the statement. True social justice is possible when.
Now, if we want it to be.
That's wow. Just drop it. Just drop it. Just let me take the headset off. Just let me. That's okay. All right. Thank you. The next statement. Wow. You tell them. You talked about learning from your grandmother and having these experiences, how to speak truth to power and still be kind. He said, it's possible now if we want it to be. Thank you. Thank you for that. Thank you for that. Second statement. My approach to social justice is shaped by
My community.
understanding and sharing our social justice origin stories is important because
It allows us to know that we are not alone and to activate people to know there is no single story.
so that was it. That's the 3 prompt thing. Wow. That's going up. That's gonna be a clip. That's gonna be on the front page or something. Look, y'all, if it's possible right now, it's just do we have the will? Do we have the courage? I think you mentioned courage, that word courage early on. Courage to have these conversations, courage to make the changes that are necessary. So thank you so much for sharing that. My sincere hope is that your storytelling, the storytelling of all of the folks who have contributed to this project will last for many years to come, quite honestly, even beyond our time. And so for future generations who may somehow stumble across this recording in some way many years from now, what's something you'd like to pass to them? Is there anything you'd like to say to them or that you want them to know?
If you're listening to this and many years have passed, it's now your turn to keep the story going and keep the movement going. Many of us will pass, many of us will go do other things. It's on you. And this idea of you have a full responsibility. And I think the one reflection I would have, and this was actually happened after my son was born, where I started thinking there are more future people than there are current people and people that have ever existed before. And so it's on you to how we think about health and wellness for the future generations. And that's a heavy burden. But know that you don't have to do it alone. Find your tribe and make change happen.
If you had to give a title to the origin story that you shared, what would the title be and why?
That's a good one.
If you had to give a title to your origin story, what would the title be and why?
This sounds so silly, but I feel like I have to give context to it. I would say Phoenix Rising.
Yeah.
Because one of the things is I've never shied away from being able to experiment and fail. And I like to reframe fail as figuring out answers and implementing learning. And so in many ways, it's like the Phoenix. There's a rises up, you try something and sometimes it dies, but then it's this idea that it's constantly being resilient, constantly rising again. And so even when you fail, don't ever get discouraged because there's another time you will rise up.
Thank you. Phoenix Rising with Dr. Bryan Buckley. Thank you so much. Thank you so much for being here. Thank you for sharing your story. We appreciate you.
Thank you for having me.
Thank you for listening. If you enjoyed this episode, please leave a review on Apple Podcasts and subscribe to Social Justice Origin Stories there or wherever you get your podcasts. You can also watch video episodes on YouTube at Social Justice Origin Stories, and I'd really appreciate it if you subscribe there as well. Video episodes are also available on the project website, socialjusticeoriginstories.com. Follow the project on Instagram at Social Justice Origin Stories. I'd love to hear about how you're engaging with the stories. Share your thoughts at socialjusticeoriginstories.com/contact or by emailing stories@socialjusticeoriginstories.com. To support the work of Social Justice Origin Stories, consider becoming a monthly patron. Your contributions will help keep this research going and support its mission. Visit patreon.com/socialjusticeoriginstories to learn more and to make a contribution. Again, that's patreon.com/socialjusticeoriginstories. You can start or stop anytime. Social Justice Origin Stories is edited, hosted, and produced by me, Rolando Tompkins Jones. Many thanks to our storyteller this week and the many storytellers who have contributed to this project. And thank you for joining me this week. Take care.